Welcome to AXA Health Chats. I'm Jan Vickery from AXA Health, and I'm joined today by Dr. Nick Nabarro from ProblemShared. Let's kick things off, Nick, by perhaps asking the obvious question: what is ADHD?
Hi, Jan. Thanks for having me. ADHD is an acronym, and it stands for Attention Deficit Hyperactivity Disorder. ADHD is signified by patterns of behaviour, and those three patterns are typically: one, attention deficit, so inattentiveness; two, hyperactivity; and thirdly, so that's excessive movement; and thirdly, impulsivity. And impulsivity is really hasty acts that occur in moments without thought.
Interesting, because I think a lot of people they get the lack of ability to concentrate and focus. That's sort of well known.
Yeah.
I think people are less aware of hyperfocus, which of course is quite a cool thing to have, perhaps. But the impulsivity is something that I think a lot of people don't appreciate that could come with ADHD.
Yeah, I think we're about to get drawn into a really interesting conversation. Maybe that's your point. But I think ADHD is broadly misunderstood. I think spectrum conditions, spectrum in inverted commas, are broadly misunderstood. Because something is a spectrum condition, it affects different people differently. Its impact is of differing severity. People assume that everybody's on the spectrum somewhere. It's the wrong way of thinking about it.
Yeah.
Does that make sense?
It does, but what's the right way of thinking about it then?
Okay, fine. So the right way of thinking about it is that if you have ADHD, you will be somewhere on that spectrum of ADHD, i.e. from mild, moderate to severe. Not that everybody is on a spectrum, and depending on how much of that spectrum you are on, you therefore warrant a diagnosis.
I get a lot of people who say to me, I'm pretty sure I've got ADHD because I can't concentrate or I struggle to focus on something. So the sort of perception that's out there, people relate to that and then wonder whether they have ADHD. Some people are not sure that they do. But what would you say to people who are wondering?
This is part of the conundrum of psychological conditions. We don't have blood tests for them in the same way as we do for physical health conditions. If you have infection, you look at CRP rates and you can see if they're rising. That's pretty indicative of infection. Whereas with mental health, all mental health conditions are defined by a pattern of symptoms, effectively.
Yeah. And actually, it's interesting that you use the word mental health, because there is also, I guess, an interesting discussion point around mental health and neurodiversity and where they fit alongside each other. Does being neurodiverse mean that you are mentally unwell?
No, not at all. No, it's that is a huge misperception, quite frankly, and something that we at ProblemShared have been pushing hard to help debunk. But there's a massive movement trying to debunk this myth across the broader population. That's fantastic, as it should be. However, it's more complicated than that, because very often, if you are neurodivergent, you will have a comorbidity, and that comorbidity may be a mental health disorder, such as, for example, anxiety or depression.
And I guess it may be directly linked to your neurodiversity.
Exactly. And it may be the result of the way in which you've been treated by a neurotypical society, quite frankly, and the result of you finding it more difficult to relate to neurotypical people or neurotypical conventions, all of which make you feel more like an outsider. So it's of no surprise whatsoever that these mental health conditions occur in the neurodivergent population.
So how does one diagnose ADHD?
ADHD is defined in something called the DSM, which is Encyclopedia of Mental Health. In order to be given a diagnosis of ADHD, you have to satisfy a certain number of criteria. So a diagnosis is based on the presence of persistent symptoms that have occurred over a period of time and that have been particularly noticeable over the past 6 months. ADHD symptoms have to have been present before the age of 12. And they also have to have caused the person being assessed difficulties in more than one setting. And by that, I mean at school and at home, or away from home and at home. How is ADHD assessed? So it involves taking a history from the person that wishes to be assessed. So that's the child or the adult that's being assessed. It involves getting a collateral history from somebody who's known them in childhood that can...
Under the age of 12.
Absolutely. To establish how impactful, whether these symptoms were present, and then how impactful those symptoms were. In children, it involves getting school report records, so you can see what their teachers have been saying about their behaviours or performance over time. And bringing all of that information together and then having a further conversation, so that all happens before the assessment, and then having a clinician sit down with the patient or client being assessed, and then having a discussion about how their symptoms are impacting their everyday life. It was believed that ADHD was a disease of childhood, and that it resolved by adulthood. I mean, until very recently, it was believed that. And in fact, there are still people that do believe that. So, however, the research shows that actually, if you've had symptoms of ADHD as a child, 70% of people who've been diagnosed with ADHD as a child go on to have symptoms of ADHD as an adult. The only difference is that the symptoms change.
As more and more people are diagnosed with ADHD, and as people become more inclusive and understanding, is there perhaps a risk that it feels like it's normal, which of course it is, but is there a risk that we forget about how difficult it is for neurodivergent people to function in a neurotypical society?
Yeah, 100%. I think whilst in medical circles ADHD has been well known about for many years, it's been extensively studied, lots of academic papers established. We know the diagnostic criteria. I think that there has been rising awareness over the last 10 years at least. And to a degree, it's become a movement.
Yeah.
As things become movements, like any movement, and people embrace those movements, I think there can be some hyperbole.
Yeah.
In both directions, commentators saying ADHD doesn't exist, whilst at the same time you have people who are embracing neurodivergent identities and discussing them as superpowers.
Yeah.
And I think, like always, the truth lies somewhere in the middle.
Yeah. You talk about some of the challenges that a neurodiverse person would have in a neurotypical society.
Yeah, so we'll talk specifically about ADHD. So we've spoken already about impulsivity, hyperactivity, and inattention. So you imagine having a constellation of those three things, and then being expected to, for example, as a child, sit in a classroom for 8 hours and listen to one teacher, or Another example, having to prepare well in advance a piece of coursework, having to research this piece of coursework over 6 weeks, when actually you do find it very difficult to sit down and concentrate unless supervised, unless it's structured. Butting in, for example, butting in conversation, having verbal outbursts, again, a sort of stereotypical type, and everything is nuanced here. Yeah. So it could be, but butting in is socially unacceptable. So people with ADHD often find it difficult to forge relationships, especially early on. Just to bring us full circle back, a moment ago I spoke about the difference in presentation of ADHD in childhood versus adulthood. So very often what you find is in children it does present as inattention and impulsivity, whereas in adults have learned that impulsivity, hyperactivity has consequences in a neurotypical society, in a neurotypical world, and so they suppress those parts of themselves. And of course their neurodivergence appears somewhere else.
Yeah.
Whether it's typically in adults, in fact, it's inattention. And how does that impact an adult? Well, an adult is at work. It impacts their academic performance, careers. It impacts their working lives. Typically, they could look vacant in a meeting because actually they're checked out. But these things have real impacts on people's lives. Yeah. And in a diagnosis, if you've not been diagnosed, can help you better understand yourself, can also give you access to support and treatment. Now, it's a good moment to mention that treatment is not just medication.
Yeah.
Medication is just one approach, and it's a good approach.
Yeah.
But medication is often listed as the thing with ADHD. Actually, like with many approaches with medical conditions, it's one of a group of approaches which make people's lives easier. So there's a rise currently in ADHD coaching, which I think is completely brilliant. So this is supporting people with ADHD in how to order themselves, how to, without dumbing down their capacity as ADHDers, and the benefits that confers in a neurotypical world. On top of that, there's the educational piece around the workplace. So how should employers adjust and make reasonable changes to allow for neurodivergent individuals to really be able to better perform in the workplace, etc. Then there's medication. And then, of course, there's talk therapy, which is interesting because if you are neurodivergent and you're living in a neurotypical world, and you've tried to change to fit in, you often see the appearance of comorbid mental ill health. And I think that's an important approach that can run side by side.
Yeah. And I guess on the positive side, as there's increasing awareness, hopefully society will adjust to accommodate people who think differently. So one can imagine in 10 years' time, schools will hopefully have a slightly different approach. And I'm really seeing it play out at work. Similar things are happening. But then even as an individual, I guess if you know from an early age, you understand your strengths, you understand how thinking differently, how you think differently, you can then you can embrace that to choose a career or, your next steps in life in the context of that.
Yeah, I think that's absolutely, we all try and do something that we're good at, that we have some natural advantage and head start in. And so I think that's one thing. Know your strengths, find your strengths, know your strengths, embrace your strengths, and then work off the back of those. And I think that a diagnosis of autism or ADHD, if you're querying that finding things difficult can help you embrace that. I think it also helps in terms of the people around you better understanding how your brain is wired. And that's what we're talking about here, a different cerebral wiring mechanism, that's all.
You can really see how people who are neurodivergent, who missed a diagnosis when they were younger and are diagnosed later in life, and you see stories in the media nowadays around this, that they feel they've been robbed from something. If only they understood when they were younger that they thought differently. It seems that it must be a really big thing to have to come to terms with. It's, if only you'd known before.
Yeah, I think we've seen lots and lots of stories just like this, where I think people feel, had I had a diagnosis earlier, could things have turned out differently? Could I somehow have made a relationship more successful? Have passed an exam, had got the promotion, taken the break? Would I not have suffered the depression, etc.?
There must be a fair bit of anger around that, would it?
There is. What you see is an immediate elation. Upon diagnosis, this gives me an answer. I now understand myself better. And then immediately afterwards, you see how would things have been different, sliding doors type moment. And I think it's key to ensure that second stage is supported.
Yes. There's also been quite a lot of, on that line of conversation, there's been some specific stories around women and how they've been overlooked, particularly in the past, dismissed by GPs. Oh, you can hold down a job, nothing wrong with you. You're clearly coping fine. Can you talk a bit about the gender differences in ADHD?
Yes, I mean, the boys typically hyperactive, behavioural issues, picked up very early. As I said earlier, ADHD was thought to be a childhood disease rather than something that continued on into adulthood. So boys, naughty, loud, disruptive. Yeah, too many E numbers. Or exactly that, Jan. So really interesting. All of those typical sort of social tropes of them. Girls, not so much, because actually typically ADHD in girls presents as with inattentiveness. So back to that trope thing, you have the daydreamer. Well, she's lovely. She looks out of the window all day and she's kind of dreamy, otherworldly. Classic for ADHD. Exactly. Yeah. Young boy throws chair, runs out of class, disruptive, impactful. Yeah. You can immediately see why, undiagnosed ADHD, unrecognized ADHD has such an impact on the outcomes for children. Anyway, so that's one thing. And I think also that, if you're relatively smart, and of course, equal number of smart ADHDers as there are neurotypicals, as there are people with autism, etc., school is very structured. So if you are inattentive type, so one of those three types of ADHD, which are hyperactive, inattentive, and combined, hyperactive and inattentive. If you are inattentive type, majority of which are girls, and quite bright, you get through your exams. Because GCSEs, actually, they're pretty structured. You have lots of teacher input, and that's good. It's rather when you get to university or into work that where you really have to start controlling your own time.
So right to conclude then is the reasons we hear about women more is because so many more of them have been undiagnosed. Would you say that could be with you?
Yeah.
Can we talk about some of the positive attributes of having ADHD, and definitely not wanting to undermine the challenges that someone with ADHD has, but there are definitely some good things about the different way ADHD is think on this.
Yeah, definitely. No, 100%. It's like anything that's evolutionary. There are some advantages bestowed and equally some challenges that brains that are wired differently experience. So again, I think whilst challenge would be difficulty concentrating, it's well known, for example, that people with ADHD have the ability to hyper-focus on things that they're interested in, and they see problems differently and can solve problems differently as well. Incredible bursts of energy, creativity, novel approaches, all things which employers in a world that is increasingly competitive are desperately in search of.
Yeah.
It's just the traditional structures that are in place for the interaction between employers and employees need to change in order to allow those things to happen.
And it does seem that we're seeing some tangible moves in that direction. So there are some large corporates that are actually targeting people who have ADHD because of the fact that they think differently.
Yeah, absolutely. I mean, I saw that GCHQ, it was one of the UK security services, was absolutely targeting neurodivergent individuals to work specifically for them. Why? Because looked at problems differently, thought about issues differently, and could come up with novel solutions for things, for sure, all to be embraced. So that's changing. I think general awareness is leading to more acceptance and a more nuanced view.
I saw a lovely commentary a while ago that made the observation that the world is now facing a whole different set of problems, like climate change and so on and so forth. And we need people who think differently to solve those problems, and therefore for all the more reason to embrace and harness that different way of thinking that ADHD peers offer.
I couldn't agree more. It's just one of the wonderful things that it needs to happen. You know, we need to be able to spot strengths in people who historically, because of our own deficits, we wouldn't have spotted strengths in, you know, and it's all about evolving and embracing new in order to solve very well-seated problems effectively.
But I'm sure you get approached a lot by friends and family who are worried perhaps about a child or maybe even a colleague and say, really wonder if they may have ADHD because of this, and they might be spot on, all the right traits. What would you say to them? How would they go about getting help? And is there a threshold that you can talk about? Or in other words, quite often people worry about wasting time. They want to avoid labels and so on and so forth. How would you steer someone to navigate that space?
I have exactly, just as you say, friends do come to me and say, I'm worried about my son or daughter. And do I get an assessment? Should I get an assessment? I think labeling is important to talk about. Having a diagnostic label does change things, or has the ability to change things. And you need to think about how impacted your child is. And then you need to think about whether or not a diagnosis would help them. I think that's the key piece. Absolutely. And so I think it's a cost-benefit analysis effectively, if that makes sense.
And what would the good things be from having the label?
So we know, for example, that a late diagnosis of an ND condition often brings with it increased exposure to anxiety and depression, further impacting your life, your mental health, your happiness. And so an earlier diagnosis can reduce the impact of those things. And also just knowing yourself better allows you to protect yourself better in a neurotypical world.
Yeah, because I guess it's actually about, in order to get a diagnosis, you have an assessment. And the assessment is all about, in a way, just a label doesn't mean anything. It's understanding what lies underneath that label that then allows you to understand yourself and and have the answers to how to go forward.
Exactly that. Yeah, it's about identity.
I suppose also, especially thinking of children, it's quite helpful to have a label because people then know that you have a challenge.
Absolutely. So it's about identity, but it's also about opening doors to you accepting yourself, other people around you accepting you, and understanding what you may need to help you succeed. And so, give us an example. For those people who are have sensory sensitivities, for example, perhaps they need to be in a more quiet environment than a school classroom in order to perform at their best. So a small adjustment would be either to have a side room or to allow them to wear headphones in class or any of these things. But of course, in the traditional educational setting, that would have been a complete no-no.
Yeah. But presumably it also will open up extra funding and support. I know all the schools work differently, but having a label might be helpful in securing that support.
Yeah, it does. I think that historically it's always been viewed as you need a diagnosis in order to access this support. And actually that is becoming increasingly less true as people's understanding of neurodivergence improves. Actually, it's just a question of setting people up for success rather than them people having to prove that they score highly enough on a scale to require certain access to certain adjustments. It is. I think it's also driven by different things too, which is difficulty of accessing assessments and other things. So there's that added layer of complexity.
Okay. Are there any negatives that you can think of around having a label?
Yeah, it's largely to do with the perception of others anyway. It's a recalcitrant view. It's, I think also that having a label can make it more difficult for you to define yourself. And we should all have the freedom to be able to define ourselves.
It's a person, even though you have, with different likes and dislikes and so on.
Absolutely. So I think it's not without consequence, having an assessment. And having a diagnosis, especially a lifelong diagnosis. And I think people should be aware of that.
Yeah.
It shouldn't stop them from pushing forward for assessment. Yeah. It's just people should be aware of it.
I presume also a very obvious benefit of having a diagnosis is that then that opens the door for treatment, because presumably you can't be prescribed medication unless you have a diagnosis.
Yeah. And that's, of course, exactly right. So with ADHD, of course, you need a positive diagnosis of ADHD in order to access medication.
Yeah. Well, we talk a bit about medication because there's so much out there.
Controversy.
Yeah. Is it a good thing? Is it a bad thing? How does it work?
Okay, so there are two basic types of medication. There are stimulants and non-stimulants. The stimulant medications are really the ones that there's lots of controversy about. Why is that? It's because the stimulants, controlled drugs, they're very carefully controlled and carefully prescribed. Obviously, you would need a diagnosis of ADHD in order to access these medications, firstly. Secondly, there's a whole titration period where you're given a dose, and that dose is increased over time until you get to a stable dose. And then you're discharged effectively. Now, and one particular controversy is that stimulants are said to be addictive. And so people often worry about having these medications prescribed for their children or for themselves. They're worried they'll become addicted to them. They're also worried that it's a lifelong thing. Mm-hmm. If you're prescribed a medication for your ADHD and it's a stimulant that you have to take them all day, every day for the rest of your life. Mm-hmm. So let's debunk the first thing. The question around how addictive are these stimulants. There are short-acting and long-acting stimulants. The short-acting stimulants, there have been concerns about addiction, but in fact, it's not been properly borne out in the literature.
And is that because they leave your body quicker? Or?
They leave your body quicker, exactly. And the longer-term stimulants have effectively the impact is over the modified release medication. Have also not been shown to have any addictive properties in the literature.
Yeah. And presumably that's why these are controlled drugs with all the governance that needs to come with them for someone who's prescribed.
Yes, exactly that.
Yeah, makes sense. Can we talk a bit about how to support people who have ADHD and living with someone who has ADHD or parenting someone who has ADHD? Any top tips?
First and foremost, everyone's different. That's the first thing. Just because you've met one neurodivergent individual, all it means is you've met one neurodivergent individual. It's nonsense, really.
Yeah.
Of course, there are self-help tips for people with ADHD. Things like reminders, memos, leaving your keys in one place on the front table. All these very, very obvious things. And then there's all the subtleties. People with ADHD often also suffer from something called rejection sensitivity dysphoria. So typically they've been criticised by neurotypical peers, highlighted that they're different, feel different for their lives, and that leads to a kind of sense of feeling of failure or of not being good enough, which hypersensitizes people. So I think that's one of the challenges.
So they overly sensitive to being rejected.
Absolutely, or criticised.
Yes.
Absolutely, which can make for difficult personal relationships. And I think it's really just about understanding all of these things in the round, understanding why people with ADHD and with rejection sensitivity dysphoria, for example, feel the way they do. Of course, when you strip it back to basics, when you understand that a lifetime's worth of criticism and not feeling accepted or part of the world would lead anyone to feel on the outside a little bit defensive. Absolutely.
Mm-hmm. And I guess if you're a manager or a colleague of someone who has ADHD, getting into their bubble and understanding that is quite important, because it might change how you speak to them or give feedback or get them to change a document.
Absolutely. And be kind.
Yeah.
Right. I mean, be kind as a manager, be kind to the people you're working with, because you've all got a task to do and you all want to deliver to the best of your abilities, and some people will contribute in different ways.
What about the challenge around meeting timelines? So if you're working with someone with a child or a colleague or a friend, family, someone who just does not deliver
on deadlines.
Timelines, yeah. Any tips around how to navigate that?
Yeah, I mean, I think, work to people's strengths.
Don't give them timelines.
Either don't give them timelines or allow people to work at home in the evening, except perhaps that they won't be in the office working frantically at the time that you want to be working on the project. That their best hours of working may be between 8 and midnight or between 2 a.m. and 7 a.m. That their approach is maybe slightly chaotic and seemingly disorganized, but makes sense, perfect sense to them. Allow that freedom of discovery and then figure out how to harness it.
Because I guess also being slightly balanced with that, there will always need to be timelines. There will always be deadlines. So people with ADHD will have to find a way to deliver to the deadline.
And so then
it's going to be a problem.
Of course, but other people can help with that.
Yeah.
The creative input, for example, this is not to pigeonhole people with ADHD just as creatives, because they have much to contribute across the entire sort of span.
And presumably, of course, coming back to the fact that everyone is different and has different personalities. Some people might like a prompt 3 times a day, whereas other people that might be absolutely awful, stop pestering me. But I guess that's all about allowing, and through talking and understanding, how you can support someone as an individual who has ADHD.
Yeah, I think it's I think that's right. It's about it's all in the communication and all in the negotiation of how you work together.
And inconveniently, there are no recipes, but
that's right.
That's just life, isn't it?
Yeah,
everyone's different, and you can't have a recipe of how to get on with people.
Yeah, I think that's just an acceptance of that. I think, but neurotypical people miss deadlines too. Just let's not obsess about it. Yeah. The sole preserve of people with ADHD is not true at all. Yes, I think, if people have a diagnosis and, and you can be supportive of that diagnosis, then all the better. And then you can negotiate how you're going to work together and how you're going to get the most out of things. And I think that's the key piece.
Thanks for your time today, Nick. It's been really, really uplifting, because it seems like there's so much positive stuff happening to support people who have ADHD, but also not too much pressure either. People can choose to be who they want to with this, but at the same time know that they can get support.
So that's definitely the rosy view. I think there is a positive change that's going on, but there are also, very strong views that remain, and that are, often floated in the media about whether or not ADHD even exists as a condition.
So more work to do.
There's definitely more work to do. We do need to keep working.
Thank you.